Hysteroscopy is a small endoscope which is inserted from the uterus, and entire internal aspect of the female reproductive system or uterus and cervix can be visualized. Hysteroscopy in last 10 years has advanced so much that many previously untreatable causes of infertility can now be treated very easily with minimum discomfort and minimum complication to a woman. Because of the good sonography machine, we can now easily pick up certain abnormality of the uterus, which can be the cause of repeated abortions or which can be the cause of infertility. When we do hysteroscopy, many times the cervix or the mouth of the uterus is so tightly closed that we need dilatation, and that also helps to some extent in restoring the fertility. But the major part of the hysteroscopy advantage is to assess the size and shape of the internal lining of the uterus. The cavity may be small sometimes, may be contracted sometimes because of the previous infection or because right from the birth. So such cases we do a procedure, hysteroscopic surgery called as metroplasty. And this metroplasty can increase the size of the cavity, and that's how the fetus can easily can grow in that larger cavity. So that is the advantage of hysteroscopic metroplasty. Similarly, there are certain birth defects like septate uterus or subseptate uterus. In that, the uterus is divided in two parts because of the presence of a septum. And this septum can be very beautifully divided and resected by hysteroscopic surgery. So that is a good advantage of, without opening the abdomen, without any stitch, we can restore the anatomy of the internal cavity of the uterus. Another important problem in conception is presence of fibroid. The submucous fibroid, which is inside the uterine cavity, protruding and disturbing the shape of the internal cavity, can be resected through hysteroscopic surgery. Not only it helps in fertility, but it also helps in treating the woman's problem of excessive bleeding or menorrhagia, it is called, as well as in treating a painful menses, we call it as a dysmenorrhea. Uterus is another important cause of cancer, and hysteroscopy can identify sometimes the area from where the cancer is developing. Many women who are coming with abnormal uterine bleeding, and we do hysteroscopy and we find that there is some polyp or some growth in the uterine cavity, and we resect through hysteroscope this growth or polyp. The polyp can be simple, benign, or it can be of cancer. So thus hysteroscopy can help in resolving the doubt of the cancer, as well as it can help in confirming the diagnosis of the cancer. Those patients who have undergone abortions and not treated properly, or abortion is done at very unhealthy or unhygienic places, or patient has himself harbored some infection after the abortion procedures, they develop internal adhesions. Uterus, anterior wall and posterior wall sticks to each other, and these adhesions can cause infertility. So hysteroscopy is a tool through which we can see the adhesion, we can cut the adhesion, and again we can restore the anatomy of the internal cavity. Thus hysteroscopy helps in correcting the adhesions and helping in the implantation of the embryo. The important aspect in the development of the technology is that previously we used to have 4 millimeter endoscope, which is used for hysteroscopy. Now the science has progressed and the endoscope is just 2.4 millimeter. It means that we don't need anesthesia. We can do as an office hysteroscopy, office procedure. Patient can walk in, undergo hysteroscopy, can go home immediately without getting admitted. So this technology change and addition of the bipolar cauterization has reduced the complication of hysteroscopy drastically. In our hospital, Parak Hospital, we are doing with advanced technology this hysteroscopic surgery, and this has helped many of our infertility patients to restore the fertility, and with addition in our setup of IVF has helped them in fulfilling their dream of parenthood. Thank you.